What is a bad facelift?
Well, Rocco, while it's difficult to say specifically what makes a bad facelift, it's certainly easy to pick one out. I'd say in general, a bad facelift is one that makes the patient look bizarre or tight or aged.
Now, how can one salvage a bad facelift?
It's a difficult, technically challenging procedure. The most important thing is to evaluate what's wrong. And although you may look at somebody who had a bad facelift and say, boy, that's a bad facelift, if I was to say to you, okay, Rocco, tell me what specific things make that facelift bad, you'd be hard-pressed to say. There's unique difficulties to doing a facelift a second time on somebody. One is that you weren't at the first surgery, so you don't truly know what was done. You have to try to sort of figure it out and expect the unexpected when you get in there.
Now, how long does it typically take to correct?
It's interesting. Some patients only have a few things that make their facelift unsatisfactory. Perhaps the cheeks were not elevated, so the face is stretched and elongated, and all they need is a cheek lift. Other people, such as Miss Tripp, really required, I'd say, in excess of 10 hours of work in order to correct all aspects of her face.